Hey guys, my name is Natalie and this channel is all about massage therapy, fitness, health tips, and I help you get out of pain and into shape. Today, I wanted to try something just a little bit different. I'd like to take you through a full and professional registered massage therapy session from the assessment right to completion, what it is I'm doing and why, so that you can get a better understanding of what massage therapy is, but also what you can expect if you've never been for a professional massage before. Welcome to my office. First of all, I want to thank my dear friend and client Laurie for volunteering for this on-camera massage demo. Also, please know this video is sped up in many areas so that I could fit a 90-minute treatment into a 15-minute video. I will be noting real time as we go. Now what I'm doing in this part of the video is Laurie's assessment and orthopedic testing. I'm collecting subjective and objective information, which means what Laurie is telling me and what I am seeing to create her massage treatment plan. Laurie reports she's feeling pretty good today, however, she would like the focus to be on her neck and shoulders. Even though upper body is the focus today, I still need to check the entire body, head to toe, to determine where the problems may be coming from. In Laurie's case, I have determined that the posterior neck, upper traps, TMJ, and psoas major are the areas that we need to focus on to help her with her neck and shoulder tension. I will further explain as we go. Next, I snuck out of the room to allow Laurie some time to disrobe and get onto the table. How much clothing you choose to take off is completely up to your comfort level. You will always be covered appropriately with the sheets, no matter how much you choose to take off or not. The first technique I'm doing here is done without oils, as I'm doing some fascial stripping to her upper traps, using my thumbs to really pull the tissues apart, specifically hydrating the area, but also creating space between some of the muscles that come together at the base of the neck and top of shoulders. I then move on to the pectoralis muscle group, or the chest muscles. In fascial work, we do not use any massage oil, so now I am going to apply oil for general massage. Now I am placing oil on my hands, and you'll notice how I'm rubbing it into my hands first. Then I am applying it to my client, rubbing it into her skin. And then I get started with some general, more relaxing techniques just to get her used to the different feeling. And then everybody's favorite part, the back of the neck into the AO joint, where I'm just breaking up some of the muscles with a little bit of transverse frictioning. And down into the traps again, a little bit of the deltoids, and sneaking into what is known as posterior scalene. Posterior scalene is one of 3 scalene muscles of the neck. It elevates the second rib and tilts the neck to the same side. Injury often occurs to this muscle group due to whiplash, excessive coughing, pulling, lifting, carrying heavy backpacks or handbags, and many times patients will report pain in areas outside of the postscalene. The pain is often directly attributed to this muscle. One of the biggest rules in massage therapy is that whatever we do to one side, we do to the other. This is for multiple reasons, but some of the main reasons are that we're not symmetrical, so we're checking for imbalances. Another reason is that often we feel pain in the overstretched side, so the opposite side is actually the side that needs to be treated to correct that imbalance. And another reason is so that the brain and the nervous system get an equal balance and stimulation equally on both sides of the body. In this session, it took about 5 to 7 minutes on each side to release her posterior scalene and correlating muscles. Once I was satisfied that the right side was comparable to the left, I moved back to the back of the neck And now checking the cervical vertebra of the spine, so your neck vertebrae. I am going through from C7, so the lowest part of your neck, all the way up to C1 and the AO joint to check for any lack of movement or maybe too much movement. In Laurie's case, I found a restriction at C4 and a rotation at C5. I worked on the area for about 6 to 7 minutes before I felt it let go and confident we could move on. Now this is a hot towel I'm wrapping around her neck. The heat will further increase blood flow and clean out metabolic wastes, and plus it feels good. Now remember how I said at the beginning of the video that I thought her jaw was responsible for some of her neck and shoulder tension? That is why we are going to move into some TMJ work and inner oral therapy. The TMJ and jaw is an incredibly important area of the body that is often overlooked by almost everyone. The jaw holds so much tension. If you are experiencing any type of chronic pain, tension, maybe headaches, back pain, or unexplained discomfort, maybe take a look in this area. This could be the missing link. Try this right now. Open your mouth as wide as you can. Stretch your jaw. Did you notice how the tension in your entire body maybe subsided? If you're curious how you can self-massage your TMJ, I have a video for that. I'll put it up in the top right of your screen right now. Next, I'm going to help Laurie stretch her jaw muscles with a muscle energy technique. This is further demonstrated and explained in the Self-TMJ Massage video and many of my other videos. Now I'm checking the movement of the TMJ joint. And down there, that's where your tongue attaches. I'm massaging her tongue through her hyoid bone. I had determined by checking her jaw movement that we needed to go inside and get to a muscle called lateral pterygoid and the inner fibers of masseter. Obviously, we use gloves whenever we go inside the body. My finger is at the very back of her teeth, in this case on the outside, where I'm manipulating the inner fibers of masseter. Laurie is gently opening and closing. I am rocking her head back and forth while I place pressure on that muscle. And then I move on to the inside of the teeth for lateral pterygoid. Whatever I do to one side, I do to the other, and each side took me about 5 minutes. Once I am done treating the TMJ and jaw, I move back to the neck and shoulders to check and see if some of the tension has released. Treating her jaw made a world of difference in the shoulders. However, it softened things up so much that I found something much, much deeper at the very top of her shoulders that we're going to treat with some fascial work. For this technique, I've moved Laurie back to her side and I'm now removing the oils. We need a good grip on the skin for fascial work, as it is mainly shearing and pulling tissues apart. So what I'm getting into here is a muscle called supraspinatus. When supraspinatus becomes tight and short, it'll actually bunch up your shoulders. And that, combined with the upper traps, can give you the appearance of what's known as a dowager's hump. If you think you have this problem developing, I also have a video for that too. I'm going to place it up in the top right-hand corner of your screen now. Give this one a try, it feels great. Reach your opposite hand across the body to your opposite shoulder. Find the bony part of your shoulder and come just inward into that little groove. Shrug your shoulder up and pull with the opposite hand in towards your neck as you reach that arm down towards your toes. Repeat a few times and make sure you do both sides. Here you can see the groove at the top of the shoulder a little bit better. It took me about 7 minutes on each side to feel the release. This next segment, I'm moving into the hip flexors, specifically psoas major. We access this muscle through the stomach wall. What you just saw was a draping technique we use to make sure she feels fully covered and only exposing the area I need to work on. Psoas major is a very highly misunderstood and complicated muscle. In Laurie's postural, I found the top fibers of this muscle were possibly pulling her rib cage forward at the bottom and tilting it back at the top, creating a bit of what we call hidden kyphosis. This is a common problem for a lot of people as these muscles become short and pull you forward, and then your neck gets all congested and locked up. If you have chronic back pain, tension, maybe you feel like you just can't stand up straight, or you're getting shorter, maybe check your psoas. You'll thank me later. Not sure how? I got multiple videos for that. I'll pop them up in the cards. And to wrap up Laurie's treatment today, we're moving into general deep tissue back massage. In the last 10 minutes or so of your massage, you can expect your therapist to move into more of a relaxation-based therapy and move away from therapeutic techniques. This is designed to help calm the nervous system and allow the nervous system to accept the changes that just took place. A lot of times, by just treating the front of the body, we take a lot of pressure off the back, and that alone relieves back pain. Without all that tension coming from the front of the body, the back can just relax and rest back into its normal position. However, I did find a lot of residual tension in her left lower back, which would correlate with that spastic right psoas we found earlier. If I didn't clean up the left lower back, I guarantee you next week she'd be in my office complaining about that problem. What is the difference between relaxation massage and therapeutic massage? A relaxation massage are more of a smooth, gentle treatment that promotes general relaxation, relieves some muscle tension, and increases circulation, compared to a therapeutic massage, which is a general term which describes any type of massage modality that helps relieve pain, reduce stress, make changes, structural changes in the body, and works on specific problems. As session was nearing the end, I instructed Laurie that I would be leaving the room so she could get dressed again. I also left her a nice hot towel to wipe off any oils should she choose to. When Laurie was all dressed, she joined me in the other room where I brought her some water for hydration, and we discussed how she was feeling in comparison to when she came in. We finished sessions just the way we started, with another assessment and postural to mark any progress and determine remedial care. Remedial care can be exercises, stretches, health tips, self-massage, or other things you can do at home to help maintain your treatment. And that is what you can expect from a professional massage therapy session. Well, I really hope that was interesting and you enjoyed that video. I hope you learned a couple things about massage therapy, maybe a little bit about yourself or why we do the things we do. And if you're super curious about massage therapy, maybe you want to become a massage therapist, maybe you just want to learn some techniques to help yourself or your friends or your family, or maybe you just love being massaged. And make sure you're subscribed to this channel. Or maybe even jump back and take a scroll through many of my videos that cover all sorts of subjects on how you can massage, how to self-massage, how to massage other people, and how movement is massage. So please go ahead and talk to me down in the comments. Or if you want to get in touch with me directly and privately, you can head over to Instagram under the same name, Natalie Heals, and follow along there, or even shoot me a private message. I'll be sure to respond. Thank you so much for watching right to the end. I hope you have a wonderful day and happy healing.